Good morning, everyone. Dr. David Kulla here. Could be good evening for some of you. But I wanted to go over a really great case. We have here somebody with a lot of arthritis in the hip. He's hobbling around, but we also have confirmed that he has a lateral subluxation of the hip joint. Now that's kind of rare, right? Because typically when hip joints, and I'm talking about where the leg bone meets the acetabulum right in here, the hip joint typically has an issue with internal and external rotation. And those are usually the adjustments I do. Not often I do lateral adjustments. So he has been working on oil rigs most of his life. Yeah?
Yes.
And it's a lot of hard work and labor. And so he has developed a lot of arthritis in the hip. And thankfully, the arthritis is on the outside of the acetabulum, the outside of the hip joint. So I'm able to adjust him. If it was on the inside, me adjusting him would certainly make it much more uncomfortable. And I probably wouldn't be able to adjust him from lateral to medial due to that fact. Okay, so the arthritis is in the right place here, I suppose. So we have not resorted to cold laser therapy. Cold laser therapy would be really effective in reducing inflammation and pain. We've treated you, what, twice already?
Yes.
Twice, and he's doing better. He said he had some improvement. How much improvement would you say you've had so far?
Well, it decreased a bit. Let's say if the pain was 10, now it's about 7.
Okay, so we've had about a 30% improvement with 2 visits. That's good, but I definitely want to see more improvement there. I'm a little bit concerned because this is a possible surgical case, okay? We're trying to avoid that for him, but it's only a matter of time where he's probably going to need surgery. So we are probably going to refer him out to see somebody for hip resurfacing, and that's what I wanted to talk about. So everybody knows about a hip replacement. They dislocate your hip, they cut the leg bone or the femur, and then they drill a new hip, a socket, and it's invasive surgery, but they've gotten really good at the hip replacements. But he might be a good candidate to go in, dislocate the hip, and scrape the top of the ball, the joint, the hip joint that goes right into the acetabulum, and they may be able to shave that down, some of the arthritis, and resurface the hip instead of cutting it off and drilling in a new hip joint, right? So hip resurfacing is a new technique that's been used for maybe about 10 years, give or take, and not everybody's a candidate for it, so you need to go see a surgeon that does hip resurfacing, but it's much less invasive than a hip replacement. Recovery times are faster, and I've seen the outcomes are better. I have a couple of ex-pro athletes, friends that have done that, the hip resurfacing, and they're doing much better than a lot of the ones that have had the hip replacements. Now, hip replacements last, though, for a good 20, 25 years. So something to consider depending on your age. So right now what we're doing is scraping. We're right here opening up the IT band. I'm gonna give him some stretches so he could start at home. We haven't done that yet. And loosen up this IT band. And by doing this, loosening up that IT band, you're taking pressure off of the hip joint. You're loosening those muscles up so the leg can elongate in a sense, right? And then we're gonna adjust them. I'm gonna show you how we do a lateral hip adjustment. And this is called Graston technique. I've done plenty of videos on this technique. And he asked me if he could go swimming. Swimming is one of the best things you can do for hip problems, so you can take pressure off of it, and really helpful for the hip. You don't want to be putting tons and tons of pressure on it. So I definitely recommend him swimming. Now, swimming is also going to tighten that hip joint up, tighten all the muscles around the hip. So even though he may swim, he's still going to need to do those stretches afterwards. So when you get home, you'll have those stretches in your email. You have to download this app, and then the email will send you a code with, a password. So you can get into your stretches, your account. And I'm able to see if my patients are actually doing the exercises too. So a little bit of accountability there, but that's kind of nice. So I could see if the patients are doing their stretches. Now we're going to adjust him, but what we're going to do is stretch out the leg. So I'm actually going to traction his leg out in another direction, that way, away from him. So you're going to put your leg right here. Yep. So we just strap his leg in right there. Some of you can't see that. You'll see his leg right here strapped in. Okay, and now we're going to go ahead and traction that out. while I adjust him. And just square up onto your hips. Yeah. So my motion is lateral to medial, but also S to I, superior to inferior. And we do that because we want to take pressure off this hip. Both movements are important. Now we're going to traction them out a little bit more. So using a mixture of traction, decompression, and this is called Thompson technique. You'll hear the table dropping below. It's a specific technique, needing a specific table. Dr. Clay Thompson is the one who invented this technique. Almost 30 years ago, I was trained by his daughter. So he had passed away sometime when I was in school. And we're going to do another one here. You ready?
Yeah.
Okay. Now, I'm going to have you turn over on your back. Now what I'm going to do is check his psoas. Why his psoas? Well, his psoas is the only muscle that attaches the hip joint to the lumbar spine. Okay? See your hands up in the air. And you can tell our viewers it's just your right hip, correct?
Correct.
Yeah, so luckily he doesn't have it on both hips. And some people struggle with both hips, and imagine having both hips surgically replaced. That can be tough, and I've seen people do that. And recovery time is pretty quick, a couple of weeks, you're back on your feet. But with hip resurfacing, it's faster. So I'm gonna have you bend this leg here. So I'm gonna get right in here in the psoas muscle. I have to kind of get in the way. Some of you aren't gonna be able to see. And we're gonna just release this muscle. The only way to get to the psoas muscle is through the stomach. There's no other way. So if a doctor's telling you he's releasing the psoas and he's not sticking his hands near your, in your belly, near your belly button and your anterior superior iliac spine, your ASIS, then he's not releasing your psoas. I don't know what he's releasing. So it's the only way to get to the muscle, and it's deep. It's a deep muscle. How's it feel?
Okay.
You sure?
Yeah.
Most people hate this.
Yeah, it's not good, but
It's not comfortable.
fine.
Yeah. Yeah, it's definitely probably one of the more uncomfortable things that I do to people here in the office. So I hope that helps you guys. If any of you are having hip pain and are considering surgery, hip resurfacing is one option. Going to see a chiropractor, that is familiar with extremity adjusting, which is called the CCEP. It's a certified chiropractic extremities practitioner. It's a certain certification or degree, which I have. And a lot of chiropractors around the world and around the country have it, but they're specialized in doing hips and knees, ankles, feet, fingers, wrists, shoulders, elbows, and the spine, of course. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.